Afternoon. My name is Registered Nurse Colleen Danieluk, and I'm here with my 59-year-old white non-Hispanic female patient, and we will be conducting a nursing health history and a family history today. All right, now, shall we get started?
Sure.
So, I'm looking into your background, and I see that you are a nurse as well, a registered nurse. And I see that you have a primary care physician in the area. Do you obtain yearly physicals?
Yes.
Okay. All right. And you're also a nursing student. Yay! So how long have you been a nurse?
For about 12 years.
For about 12 years. Wow. All right. Yeah, I know that feeling. And your educational level? What's your education?
I'm currently in a BSN program.
Okay. So you have an associate's degree?
Yes.
Awesome. All right. So do you have a specialty? What's your specialty in nursing?
I'm in the home health area.
Home health. Okay. All right. And what about, tell me more about your work duties, your schedule, and the type of work you do. Is it particularly strenuous work? Are you pushing, lifting patients, or is it more administrative?
I think it's a mix of both because we case manage our caseloads and we go into homes. Sometimes there are people available to help you with strenuous things and sometimes there's not. So it's a mix of both.
Okay. And also, can you tell me, does your career create satisfaction in your life for you?
Definitely.
Okay. That's great. That's great. As with any health history, especially nurse, we need to get down to the meat of the history, so to speak, and the current health concerns and the past medical history. So, let's talk about your current health concerns. What are your concerns today? As far as I could tell from your intake paperwork, you had concerns about increased heartburn. So, tell me more about that.
Well, if I would eat the things I'm supposed to eat, which I'm not very good at doing, I wouldn't have the increased heartburn. Stress adds into that, and being in school and working full-time adds into that as well. So yes, I do have GERD, if you will, and I do take medication for that. But
okay.
Again, if I don't eat properly, it just
right.
adds to it.
I understand. We'll go more into that when we review our health systems today, but I understand your pain, so to speak. All right, so now we're going to look at your past health history. This is basically where you start to see allergies, illnesses, any immunizations that I'm going to ask her about. So, starting with birth, were there any birth problems when you were born?
No.
Okay, good. Any childhood illnesses, anything to that degree?
Besides the trauma that I experienced, no.
And what type of trauma did you experience?
I had an eye injury when I was younger, which led to multiple surgeries and continues today.
Okay, so nothing else. Immunizations are I imagine being a nurse, your immunizations are up to date, right?
Yes.
Okay, very good. All right, and your surgeries, what type of surgeries do you have in your past?
Besides the ones that were trauma related?
Yes.
No other ones, I mean.
Oh, so basically you got everything, all body parts, huh?
Yeah, I'm pretty healthy.
Okay, and accidents in your life. Have you ever had accidents?
Again, besides the trauma that I had as a child,
okay.
No.
Okay. And we mentioned that the reason why you're here today is because you have frequent heartburn. Any other pain issues or anything?
Well, it makes you nauseated at times. But
okay. Okay. So how often do you have these pain episodes?
Probably at least 5 out of 7 days.
Okay. All right. And they last about, I think you, on your intake paperwork, said 4 to 6 hours a day?
Correct.
Okay. Do they occur at any other time of the day do they occur most at?
I would say they occur more in the evening time, probably.
Okay. All right. And we'll get more into that, but I just wanted to assess your pain as well. Oh, and on a scale of 0 to 10, of course you know 0 being nothing, 10 being the worst in your life, how would you typically rate the pain at any given episode?
Well, to me it's really not pain, it's more of a discomfort.
Okay.
To rate it that way. And I would say at the worst probably a 6 I'm also very bad about using pain from past trauma injuries. So yeah, probably 6 is the worst.
Okay. All right. And we're going to talk about allergies now. Do you have any allergies, and what allergies do you have? This includes medications, any, natural allergies, any food allergies, anything like that.
Sulfa, if you can consider it as an allergy, they just don't give it to me anymore because it makes you very nauseated, which, as you know, is a side effect from that anyway. Other than that, I do have seasonal allergies, and so they're messing with me today. But
I understand completely. It's amazing what allergies can do to you. At the end, we'll discuss your family genogram, but why don't we go ahead and review your body systems, okay?
Okay.
All right. So far as your skin, hair, and nails, are there any concerns with that? Any concerns about your skin? Do you get cold very easily? How's your hair? Do you find that anything is falling out, for lack of better wording, falling out in clumps that would indicate any other illnesses? How are your nails? Are your nails nice and strong, no ridges or anything?
I do have a little bit of ridging on them.
Okay.
And I have been diagnosed with hypothyroidism, so the hair, some issues with that, but overall, and of course the aging process. But
Well, that unfortunately happens. I understand that. So the next system I want to talk about is your ears. Now, as far as your ears, any issues with those? Any hearing issues?
Not yet.
Okay. Any inner ear issues like dizziness or any earaches recently or anything like that? Okay. All right. So now getting to our favorite part for those who have allergies, mouth, throat, and sinuses. So what's going on there? Are you having any issues with that?
I don't know if it's from being in the state of Virginia. It's really true. They say you move here, you end up with allergies, and it seems like every season except for winter, I do have a new allergy every year. So,
okay.
But it's seasonal related.
Okay. Are you having any headaches? Any difficulty swallowing, sore throats, anything like that?
Causes headaches, and I get the sinus pressure from it.
I'm sorry, I definitely...
Coughing and stuffing at times, but...
Oh yes, isn't that great? I definitely feel your pain, because even if you're born, you're automatically born with allergies in Virginia, I can tell you that much. All right, now, we're going to talk about your thorax area, your lungs area. Have you had any problems there, any shortness of breath, at rest or at your daily routine, wheezing, pain, cough, changes in your sputum, any recent respiratory infections?
No respiratory infections. The allergies sometimes cause me to have the cough and a little bit of wheezing, but once you take the allergy medication over the counter, it clears up. Nothing serious.
Okay, but no shortness of breath at rest or at activity?
No.
Okay, good. Okay, so now we're going to kind of get a little sensitive here, but I do need to ask these questions. Your breast area and your regional lymph nodes, have you had any issues with that?
No, I'm overdue on a mammogram, but
okay.
No, I haven't had any.
Okay. Just got to ask that question. No, any issues like discharge area or anything like that? Okay. All right. Just got to ask those silly questions, huh? All right. As far as your neck and your heart vessels, any history, any recent murmurs or chest pain? Go ahead if you can elaborate on that for me.
No palpitations or anything like that.
How's your heart rate? Being a nurse, oftentimes we take our own heart rates because sometimes, we get a little nervous about our hearts.
I'm generally between 60 and 70. I do some running, so
awesome.
It will sometimes drop to 58.
Okay.
If I have time to, when I'm stressed with school and work and all that, so that the running doesn't come as often. And obviously, if I drink caffeine, which sometimes it goes that way.
I understand. I probably drink too much myself. And your blood pressure, do you know what your blood pressure is typically run?
Yeah, about 120/60.
Okay, that's awesome. Very good. Okay, next we're going to talk about your legs, your arms, peripheral vascular system. Any problems there?
No, I tend to stay on the cold side. I've just always been that way.
Okay.
Hence, I have the jacket on already after I come inside. So, but I've never been diagnosed with anything that would say that there's a problem.
So no thrombosis or edema. Usually when I'm talking to patients, I don't technically use those descriptive words. However, she is a nurse, so I feel comfortable that she understands the terminology as well as I do, being that we're both associate degree nurses. But anyway, all right, getting to your abdomen. Any problems with your abdomen? Any GI tract system upsets or anything like that?
I would say if I don't eat properly, experience maybe some constipation here and there, but that's just, I think, from not eating properly.
Mm-hmm.
Some people have the opposite issue, but I've never had that, so.
Right. Okay, so we were talking also about the GI system, the abdomen area. You also mentioned about that you were having some constipation possibly from irritable bowel syndrome, which people in the medical field and in any high stress positions can develop irritable bowel syndrome. Now, let's go ahead. Any other issues? You mentioned increased GERD. Is there anything that actually kind of accompanies that? Anything like a hiatal hernia?
Yeah, I do have a hiatal hernia that I've had for years. But again, as you said, that goes along with that. And sometimes it causes some pain in the abdomen area.
Right. Typically up in the upper left?
The left upper area, and it's consistently always swollen there, but that's because of the hernia itself. But
yeah, that's fine.
And then again, if you eat something that agitates it, it feels more uncomfortable, which makes sense.
Yeah. Okay, and no problems with the lower G-tract area?
No.
No problems with that? Okay.
When I was younger, I had a lot of urinary tract infections, but as I got older, that changed. I don't usually it's the reverse for a lot of people, but.
And nothing with the gastrointestinal system as far as the lower aspect, so to speak? Okay. All right, now we're going to talk about your gynecology history. So I need you to just give me a background on that. When was your last pap smear?
Well, at my age, I have been one of the lucky ones to have already stopped normal things that people have.
Okay.
So I don't have to do them as frequently, but I am ready for another one. So I think it's every couple of years now. I think they've changed that periodically. So everything has been fine, so I don't have to go back any more frequently than anybody else would have to.
Okay.
Do you want to know about how many children I have?
Absolutely. I was just getting to that. As far as your children?
I have 2 grown adult children, both of which are healthy at this point, and I had 1 miscarriage in between those, so total of 3 pregnancies.
Okay. I'm sorry. That must have been a difficult time for you.
Well, you know.
All right. So, any other, I know here in your intake paperwork you had mentioned that your, when you had started your period, you started around age 12, and your last period was when, approximately?
In my 40s, my late 40s.
Late 40s? Okay. Any history of any problems with any other particular areas of that nature as far as sexual reproduction health?
No, I'm healthy.
Okay, great, thank you. All right, so next thing is we're going to talk about the other part of the area, the anus and rectum. Any issues there?
No, other than the constipation, but you know, with doctors' help of medications, you can prevent the outcomes that some people have with those.
Yeah, I hear those can be very hard to deal with. All right, so now we're just going to talk about your lifestyle practices and your health practices, okay? So, and you're very well of this because you know activities of daily living and typical day. Just give me a rundown of what your day is like as far as what activities you do, things like that.
Okay. Well, as I said, I work at least 40 hours a week.
Wow.
you know, that can give and take depending on if I'm lucky and get a vacation, as well as it can be overtime that we pull in. But at least 40 a week because I'm a full-time person. So the day starts early and you get up and you go into work. That's my first habit. I've tried to do the exercise thing before work. Doesn't work for me because I also like to sleep. So I get up and I go into work. I come home, and I'm lucky enough to have a husband who, if he gets home before me, starts dinner, so we can usually eat and then go to the gym after that. And that's usually, we try, he goes far more often than I do, but we try at least 3 to 4 times in the week's time.
Okay.
And then you go home and you go to bed and you start all over again.
Okay.
I do have a granddaughter, so I try to keep her a couple of times a week.
Aww.
And hence that's why it's important for me to exercise anyway. I do like to walk, so I try to walk some during the week as well.
Okay.
Sometimes when things are a little hectic at work and I have pre-terms, you know, midterm exams like this week, things get cut back a little bit. That's when I should be on the opposite end, continue to walk, because that would decrease the stress level, but it doesn't always work that way.
Okay. All right. And I assume you eat 3 meals a day, or at least try to.
Yeah, I'm the typical nurse, I think, you know, trying to, I never skip breakfast. I have never been one to skip breakfast. I believe in breakfast. And
very good.
Truthfully, that can carry me to a late afternoon, so I'm the one that skips lunch if I need to.
Okay.
Or it's something that it shouldn't be. I carry apples and things like that in the car, but sometimes they just don't hit it when you think you need that chocolate piece, you know, in the afternoon, late afternoon.
Oh,
but,
yeah.
And I generally don't skip dinner, so I am definitely a two meal day person. The lunch is a little skippy here and there.
Okay. All right. And so you work 10-hour days. Oy vey. So
actually,
you do
I work 8 in the job that I'm in right now.
8. Okay.
I have done the 12 and 10-hour days, but
yes.
It's supposed to be 8, but you know how that works out.
Yep, do I.
Realistically.
Absolutely. All right. And your diet for the past 24 hours, what has that been like, to be honest?
I like to have protein in the morning, so I generally hit towards eggs because they, again, hold me longer. My downfall is the bread that I add to them, but, you know, everybody has their habits. And I always have cheese, so that adds me. And I said it does carry me through the day. My lunch, I should be having a snack, you know, and sometimes I do and sometimes I don't between that, which will be, you know, an apple or a granola bar. I'm not a really big granola bar fan. I'm the one that I feel like that the additives aren't really that good for me either, so it's better to pick up something else to eat. Right. So even if it is a sandwich with bread on it, peanut butter and jelly or something like that. So, but the peanut butter is the protein, so.
Yeah. So do you occasionally cheat?
Oh yes, yes. I would be lying if I told you I did, because I do like chocolate chip cookies and they're fast and easy on the go, you know.
They are.
Instead of the candy bar, which I do have once in a while, but I tend to head towards those granola bar things with the chocolate that they're now mixing in with those. So.
Well, you do better than most people, let me tell you.
Well, and I don't buy potato chips because I can, you know, eat too many of those, so I just don't buy them.
And once you pop, you can't stop. All right. So you talked about your exercise regimen that you like to walk and run. How often do you do that a week?
At least 3 to 4 times a week. I actually am a member of a gym club. So, and they have a lot of things at the facility there, such as swimming and classes. So the only thing I do like to do is walk and run some. I am not so big into exercising. I have to make myself do that. I feel like most people probably do, but so they have a wide choice of selections for me to do.
Okay.
When I get bored.
In one particular exercise episode, how long do you exercise for?
Usually either I do 30 or an hour.
Okay. In that time, obviously with the running and walking, you get your cardio in. What about weight-bearing exercises? Do you do any weightlifting? I mean, look at that. She got some muscles in there. She got more muscles than I do.
Probably the most I do is picking up my granddaughter. You know, I don't do very much of that. I'm probably lacking mostly on that because I find it pretty boring to do it. My husband does it all the time. But, and I, you know, That's the truth. I'm just really kind of down in that, I guess.
Yes, weightlifting is not the most fun thing, and you're right, sometimes it can be boring. But that's something, you know, that we can always work on. As far as and we can try and make it fun. As far as your sleep patterns, tell me about those.
To be totally honest, again, if I give up anything between the two things I should do the most of, if I'm giving up because I'm trying to get exams done or something, it's going to be either the exercise piece or the sleep piece. And it's unfortunate because I really like to get my sleep in. I try to get at least 8 to 9 hours, but it'll go to 7 to, and I've been lucky to get 10 once in a while when it's been a little bit, you know.
Okay.
I'm getting older, so it's harder laying in bed sometimes.
When do you typically go to sleep? Just about an average?
10.
Okay.
And I've been known to go at 9, but
Okay.
10, and I've been known to go at 11, which I said sometimes is fine.
Well, sometimes, you know, you have to be that little night owl, so that's understandable. When do you wake up?
Usually around 7.
Okay.
That's a
All right.
normal day.
Okay. Any problems with your sleep quality?
The higher the stress, the harder it is for me to sleep.
Okay.
So finding ways to decrease that, such as walking or exercising. And most recently I thought, oh, you know what, I used to like to color as a child, and you'd be surprised at how focused that makes your mind. If you just pick up with my granddaughter, I thought about it again. So
Yes, absolutely. Studies have shown that coloring, which has been the craze now for probably more than a couple months, has actually shown to relax and focus someone, because I do it too. I have the adult
Yeah,
coloring
it's
books.
surprising it's coming back. The coloring is, I was like, wow.
Especially those geometric designs. So, let's see, what else? And you have no trouble falling asleep or staying asleep, correct?
As long as I keep the stress level under control, because otherwise my mind gets carried away with me, and then I have trouble falling asleep.
I find that a lot with nurses, is that we just keep running and running, like we're little gerbils on the little wheel of life.
Problem solving, and that's what
Yeah.
we do in the middle of the night or on the drive. In my case, working in home health, sometimes driving from if it's a long distance between one patient and the next, you get your best solving problems sometimes then.
Oh yeah, I used to run through scenarios through my head about what would happen if, you know, a patient were to, well, code on you, for lack of better wording. Anyway, let's go ahead and get back. I think we finished and we covered that sleep patterns very well. Medications. What type of medications are you on? If you can give the strengths, how many times, you know, you take them, all that other good stuff.
Basically, besides vitamins, which I do take vitamins,
Okay.
especially when, you know, I know that it's close to cold time seasons and allergies. I take the vitamin C because I do eat fruits with vitamin C, but I also take the extra vitamin C, a 500 milligram tablet a day. I take a Synthroid, which is 0.25 once a day, and that's for that hyperthyroidism. And I do some eye drops because of my eye issues, and I take Protonix, 40 milligrams once a day for my GERD, and I think that's it.
Anything over the counter that you take?
Well, when I have my
other than
allergies
vitamins?
are up or something, I do take, sometimes I do Benadryl at night. It depends, because Benadryl makes me feel really tired the next morning, so I really don't like the leftover effect from it. Plus it dries you out a little bit too bad, but sometimes you've got to do that.
Yes.
Other times I'll do something like Zyrtec or...
Okay. All right. And anything else besides the Protonix for your GERD? Anything over the counter such as Tums or Rolaids?
Yes, I will do Tums. I'm not big into Rolaids. I think they're got a little bit more sodium in them. We don't need that.
Right.
And then if I'm not eating properly and need to make sure I'm going to the bathroom, Miralax works really well.
Okay. Well, that's perfectly understandable. All right. Do you use any, well, for lack of better wording, recreational drugs, alcohol, nicotine, or caffeine?
Caffeine.
Okay. Yeah. How do you, what type of caffeine do you intake on a day?
At least one 16-ounce fountain drink, so I'm not sure you're really getting 16 ounces because I love my ice. I fill it up to the top with ice before I put it in there. So I'm sure I'm not getting the 16 ounces out of there, but I have been known to at least 2 of those. I used to be a little bit better with not doing any at all, but once in a while you get addicted to those McDonald's Diet Cokes.
I don't blame you when you gotta go, go, go. You gotta pick up something, but that's one thing that we probably should work on because that can affect your gastrointestinal system very much so.
Definitely.
But perfectly understandable. We all need those go, go, go juice drinks to keep us going during the day. Now we're going to talk about your self-concept. All right? Tell me about how your life is. Do you feel safe at home?
Yep.
Health practices?
Yep, I've been married to the same gentleman for 31 years.
Aww.
So he's, like with any marriage, you know, you have your issues, but we've managed 31 years and been fine. As I said, we have 2 adult grown children and have my 3-year-old granddaughter who I absolutely love. My immediate family all live in this area. I'm Methodist.
Okay. All
So
right.
spirituality is fine.
Good.
No other issues other than if I let the stress get ahead of me with work and school sometimes.
And you're always wearing your seatbelt and getting your eye and dental exams and all those important exams that we sometimes never seem to get around to.
The seatbelt is definitely a habit for me, has always been, and I feel funny if I get in and somebody else is not wearing it. If I get into somebody else's car, I find my seatbelt anyway, so it's always been a habit for me. I don't like to go to the dentist, but I do go to the dentist. It's not my favorite thing to do. And then with my eye issues, I'm always at the eye doctor's. So
Sounds like you have great health practices. That's wonderful. Okay, so your life strategy, stressors, and your coping strategies. Tell me more about that. I understand that not only you work, but you're enrolled in a bachelor's nursing degree. So I understand those stressors, but are there any other stressors, and how do you cope with just the basic stressors in your life?
I think that everybody has some stress when you work the type of job that we have, and school certainly adds to it. The economy today certainly adds to it. So how I cope with it is trying to, one, think positive and not jump too far ahead of myself. Put one foot in front of the other, as they say sometimes. And spiritual-wise, that helps me a lot.
Okay, that's great.
As well as my coloring and my running and, you know.
There's nothing wrong with that. Not only is she managing her psychological well-being, she's also managing her physical well-being. And believe it or not, we need to treat those things holistically as nurses. Now, we already talked about your work, your responsibilities at home and work. What do those entail?
Well, I'm a mother even though I don't have a little child at home anymore, so they're very different now. It's more take care of me, which I guess that's the way it's supposed to be. On the days, though, I do have my granddaughter, so and I'm a wife, so I have the same old wifely duties like everybody else has to try to work. Although, as I said, I'm lucky as my husband doesn't mind coming home and starting dinner. A lot of people have that to worry about.
Okay. Can we clone him at any point after this
He's not
interview?
perfect.
Hey, if he can cook, I'll take him. We'll clone him, please. I need a man like that. So, we talked about your type of work, your level of satisfaction, but where do you see yourself going as far as your education?
You know, I'm not exactly as young as I used to be, so I definitely get my bachelor's degree, and I ultimately I don't want to stop there, but, you know, who knows what. It costs money to do those things,
yes.
And that's being realistic. Yes, one of my children is already through college and has her master's, and the other one is not, but, you know, have to be realistic. We'll see, one step at a time, as I said.
So we all talk about the economy today, which is, of course, a major stressor. How do you feel about your finances? Do you feel like you're financially secure?
I think we're better than a lot of people are, but, you know, security, don't know that there's such word as security anymore.
That's true. Especially in an economy like this, you are definitely seeing a lot of stressors come out in people. Hence, that's why we have a lot of road rage, I believe. Just kidding. All right, so social activities. What type of social life do you have?
It's hard to maintain too much of a social life when you work and go to school.
That's true.
But my family has always been, we get together at least once a week, my immediate family, and we manage to make that continue to happen. And that's one thing that I look forward to every week. And then, of course, I have my group of friends outside of work. I have my friends at work. With church, and, you know, I mean, I feel like I'm pretty socially involved.
Mm-hmm.
I don't have any particular clubs I go to or anything like that. But.
Okay, that's great. As we know, being socially balanced tends to help with the psychosocial part of our of being human, so to speak. All right, and we talked about the fact that you are a Christian and you are a Methodist, so you do have a nice encompassed spiritual life. Tell me about your values. What's important to you in life?
Well, let's see, if I had to put them up there, I would say God and my family, health, and financial, maybe somewhere we have to have that or we can't have the other things.
Yes, exactly.
Right on the top would be God and my family.
Okay, so regarding your environment and your residency and your neighborhood, what type of living quarters, I guess you could say, that you're...
I would say it's middle class subdivision.
Okay.
Single family home subdivision.
Very much the suburbanist, of course. And who lives with you and your family? May I be so bold to ask?
Right now, it's just my husband and I and one adult child still at home.
Okay. All right.
Unless you come on the day that my granddaughter's spending the night, so.
Aww, I love little babies. They're so cute. All right. And so we'll talk about your developmental level. Cognitive, I would definitely say that you have the formal operational thought. Moral, you're at a post-conventional level. And psychosocial, you're at the generativity level. And psychosexual is healthy. So I'm looking at those psychosocial behaviors. That's fantastic as far as I'm concerned. I'm looking at your genogram, and basically you were diagnosed with the GERD, am I correct, in 40 to 49 years range?
Yeah, I think I suffered with it before that, but before I actually did anything about it.
Okay. And that's perfectly understandable. And your father, he had type 2 diabetes, a heart attack, and coronary artery disease, correct?
Correct.
And they were pretty much diagnosed around the 50 to 59-year-old range, right?
Correct.
Okay. And then your mother, she's in relatively good health, correct? And both your parents are still living?
Yes.
That's fantastic. Your maternal grandfather, I see, had a lung disease that was, I believe, diagnosed with right before he passed away in about the 60-year-old older range.
Yeah, he was like 65.
Okay. So what type of lung disease did he have?
My grandfather was a coal miner, so if you've heard it diagnosed many times, that's black lung.
Mm-hmm.
So emphysema, COPD, they're all, respiratory illnesses. But that, and he suffered a couple years with that before.
Okay. Did he do any smoking or anything?
Yes, he did.
It seems like everybody smoked back then. Like, what was up with that?
As if it wasn't enough working in the coal mines.
Yeah. Same thing happened with, I believe it was my great-grandfather. He also worked in the coal mines up in good old Pennsylvania. Very good. So we've got that in common. That's awesome. All right, so your paternal grandfather didn't have any real disease that we know of, right?
Right.
We think he may have had heart disease, but you're not entirely sure, right?
Correct.
Okay. And much is unknown about her maternal grandmother, correct?
Right.
Okay. Your paternal grandmother, she unfortunately has passed as well, and she died of an unknown disease about 60 years or older, correct?
Correct.
Okay. All right, you have a brother who's still living. He's in great health, and both your adult son and daughter are both in great health, correct?
Correct.
Okay, that's great. I'm glad to hear that. Now, here comes the fun part. Your maternal uncles and your maternal aunts, they're all passed away, I assume. They all died, or are they still living?
Yeah, my dad's brothers and sisters have all passed away. My dad's the only one that's left.
Okay.
And I come from a rather, it was just my brother and I and my immediate family, but my dad had a lot of brothers and sisters, the same with my mother.
Okay, so, all right. And I believe that concludes the nursing health history and family history assessment. We will now get ready to do the head-to-toe assessment. So I want to just thank you, and we'll get to that here in just about a minute.